At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Natural Solutions for Shoulder Pain on Wednesday, March 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Dr. Tom Roselle Live, and we have another great program for you, as we always do, try to add to the pile of your education and your knowledge. And today we're going to talk a little bit about your shoulder and an ongoing process, but I'm going to kind of segue around a little bit. But I want to remind you that coming up on the 19th, which is a Wednesday, at the Roselle Center for Healing in Fairfax, I want you to join us. Dr. Jerry Cowart and I are going to be talking about shoulder pain, the different types of things, where they're coming from, and why you can't get it fixed. And did you know that your shoulder pain could be your heart, could be your lungs, it could be your liver? Yep. Guess what? That's that old organ muscle phenomena. And so all of a sudden that shoulder gets sore. But it also could be your neck, an old injury that it's been kind of lingering there for quite some time, and you've been putting up with it, but the nerves that go to those shoulder muscles come from the lower part of your neck, and we'll talk a little bit about that as we go through today. But I want to kind of focus you on something right now. You know me well enough that I've been fighting for health rights and your ability to choose based on what your belief systems are forever. Just because I believe one way doesn't mean that you should believe the same way. But we both have to look at it from a platform, a multidimensional platform of understanding the nuances behind why something may be taking place. And I am over the top excited right now that this administration is making some major shifts. It's kind of ugly for a lot of people, and some people are saying, oh my God, what's going to happen to me? But I believe that as time goes on, it'll resolve itself. But let's get to the point. There's this guy called Bob Kennedy, who I am super excited that he is, part of the process. And because he's promised to get into the ugliness of what you've been told, what you have been manipulated, what you have been, put on a track of, in my opinion, of disaster in your healthcare, and expose it and allow people to really come to the place of choice. But here's the deal. Kennedy is going to do something that I've been trying to perpetuate and get the information out there for a long time. So let's start from the beginning. My grandchildren will tell you that, I'm of the generation of the dinosaurs, but here's what I'm talking about. Back in my day, there was no advertising about drugs on television. None, zero, nada. Now they got these great infomercials that they're telling you, oh, you got to take this for that. And they're all biologicals. What does that mean? That means they're suppressing your body's ability to produce the symptom. It doesn't resolve the condition. In many cases, it causes worse situations like what? Death. You remember the byline? In case of allergy, and death, you shouldn't take this stuff. Well, how do you know you're going to die from it? How do you know you're going to react to it? How do you know if you've never had the thing, but go ask your doctor. So what are they doing? They're doing two things. They're forcing you to go see your doctor, right? Because now you're all, hey, this has got to work for me. Let me go talk to my doctor about it. And, the guy gets an office call. He writes a prescription, promise you that he's getting some feedback from the cartels, the drug companies, if you will. And so now, if Kennedy has his way, he wants to ban across the board all pharmaceutical advertising from television. Wouldn't that be wonderful? And that, there's still going to be stuff available online. You can go check it out and so forth and get your information. But you should never say yes to anything without making sure you understand intimately what the deal is and what's taking place. But if that's the case, that he's successful at doing this, many people are, in my opinion, are going to live better, survive. And, even now, think about what you hear on the radio. How about, the advertising, take this drug to lose weight? Well, instead of asking, why is it that your body's metabolic process is not working the way it's supposed to, just take this. It'll burn the fat. You can still eat the crap that you've always been eating and doing that. Wouldn't that be wonderful? Yeah, if you want to die of something else. So the whole idea is that you really got to understand the process. Did you know 90% of all the pharmaceutical companies is, it starts here in the United States, and, all of the statistical analysis and so it goes, and we produce 10% that goes to the rest of the world. So 90%, you're the consumer. We are. Good old United States. And 10% goes to other. Don't you think that if they could convince the other people that 10% would be much, much higher? I don't know about you, but, here's the deal. United States is, and one of the countries, outside of the only countries that have television and billboards and other situations to propagate the lies, for the most part, of what Big Pharma is trying to put in your body. I want you to reach out to your congressmen and your senators and let them know that you are opposed to mass advertising and manipulation and hypnosis of trying to get our people in the United States of America to be drugged up and doped up and manipulated in a way that is destroying lives across the board. Now, having said that, I know I'm going to get a tranche of all kinds of, how dare you say those kind of things? Well, if you want to do that, just send me a note. Go to drtomroselle.com, and I'll answer you. I promise. We'll go back and forth, but more importantly, I'm going to tell you where you can find the truth, the information, but you're going to find it here. Every time you listen to this program, I'm going to alert you to what needs to be happening and what needs to take place. Now, let's get into the program. Hey, listen, on the 19th of March, as I said earlier, Dr. Jerry Coward and I are going to be talking about your shoulder pain. And we're going to differentiate that shoulder pain into a lot of different things. It can be your shoulder because you busted it up, you did too much on it. It can be your neck because that lower part of your neck houses the nerves that go to your shoulders. And if those nerves in your neck are irritated, they're overstretched, they're compressed, your shoulder's going to feel terrible. And you have other nerves, they're called splanchnic nerves, and they're the upper part of your back, and they go to different areas as well. But here's the pattern. Remember, in my world, you've heard the term repetitively, applied kinesiology. What does that mean? Kinesiology means muscle function. Applied means that it's related to something. And that relationship has to do with multiple systems. But first, nothing can happen to your shoulder, nothing can happen to your heart, nothing can happen to any part of your body unless there was an injury of some sort, subtle or significant. There's a biochemical, bioelectrical irritation. That's all the garbage that you put in your body that shouldn't be there, things that you should put there that you don't put in there adequately. The electromagnetic fields that are around us, all the garbage they put into our foods, and on and on and on ad nauseum, right? And then the third is the decision process that you make about anything. Whatever you say is true, your body says, I'm in, let's do it. And so if you think you can, and you will. You'll heal, you'll get better, you get stronger. Your body will say, but you got to own it. But if you don't think you can, you'll break down, and your body will go down the tubes even faster. Now, they have 5 primary systems. They have the nervous system, brain, spinal cord, 31 pairs of nerves. They have the blood supply, goes to the organ, goes to the muscle. You have lymphatic drainage, AAA garbage disposal, getting rid of all the garbage. You have the energetic system, the acupuncture system. and you have the movement of spinal fluid. All of those guys can cause impairment in that organ-muscle relationship. And if you join me on the live stream program immediately after we're here, you're going to hear me talk a little bit today about the interconnectedness of how these guys kind of relate to each other. But here's what I want you to understand. Let's say that if you try to move your hand backwards and tuck your shirt in your pants, or ladies, you lift up a little higher and try to hook up your bra, and you can't do it. There's a muscle called the subscapularis muscle. What does that mean? Sub means under, scapula means your shoulder blade, and it has the ability, when you push your hand backwards towards the wall, just the hand, that's the muscle that's working. And if it doesn't work properly, then you may be having a problem with that subscapularis muscle. So why is that important? And I'm going to talk about it as we go into the live stream. That muscle relates to your heart. Remember, organ, muscle, applied kinesiology, those relationships. So you can have a subtle change in heart function due to not getting enough potassium, or too much potassium, or magnesium, more or less, and other nutrients, and all of a sudden that's not working, but it reflects itself back to what? It goes all the way back to that organ system, the heart. So you have the nervous system connecting both the organ and the muscle. So when you have a shoulder pain, patient comes into me and they say, I don't know what to do with this. I've had all kinds of stuff done. I went to physical therapy. I've taken all this stuff. My doctor's given these pills, and nothing seems to work. So I'm going to start being the inquirer. I'm going to be the inquisitor. I'm going to start digging. I'm going to ask questions like, do you take medication? And we already have it on the sheet, but I'm going to ask this question anyway. And sometimes people don't think aspirin is medication. Say, who put you on the aspirin? Well, my doc, he thinks I have a little bit of a heart problem and so forth, and gives me this baby aspirin. I take it every day. Really? He didn't tell you that it can even make it worse? They look at me like, what? And there's a reason for that, by the way. And, so you have a heart that's a muscle, and that muscle functions like any other muscle, and it has a reflex throughout the entire system. So here's the deal. If you don't identify the cause, the why underneath all of this, you can't fix anything. You begin to restrict the motion and say, oh, I'm just getting older, I can't raise my arms anymore. Oh, it's just, if I do that, it hurts me, but, if I do it this way, it's okay. If and excuse after excuse after excuse. So understand that there's always a why. There's always a why. And if you understand the why, you can fix anything that goes on. And it's a process. It's a process of taking the time, the ability. How many of you go to your physician and, you go in and you say, I have a sore throat. Back in the day, besides just taking a tongue depressor and looking in your throat, they actually might even take a swab. And they find out what's actually there. And then what they used to do is that they would see if that bacteria matched specifically the medication, the antibiotic that they were going to give you, if they were going to do it that way. But not to say that things like garlic would work better. I grew up with a grandmother that, if I had a sore throat, I didn't feel good, I had to chew up a couple garlic cloves, and guess what happened? I got better. And the old-fashioned remedies, these people knew better than most physicians knew about how the body really worked, and how, there's times where medications are absolutely necessary. But unfortunately, in the world that we live in, it's over the top, my opinion, if you will. But let's get back. I'm digressing, and I could do that all day long. A shoulder pain problem. If you really understand the flow, the diagram of what takes place, it's a useful tool, to working out what's causing the pain. There's lots of different structures that are involved in your shoulder, the bones and the tendons. There's this thing called the labrum. I have a labrum tear. Do you know what the labrum is? Do you know what the labrum actually is made? I start with cartilage and tendon and so forth, and its attachments. and it could be a bursa. A bursa is like a little sponge that's in there. So damage to any of these areas because of injury can cause pain, obviously. Overstretch, you can do it by, injury. It doesn't happen as often as your body's balanced properly, but it does happen. So there's pain, in the front of the shoulder. There's pain behind the shoulder. There's pain that goes from the shoulder to the elbow. There's pain, that goes into the chest. And they all mean a little something differently, right? So if you have front shoulder pain, you've got to start ruling out all kinds of things. But first, got to rule out the muscles behind the shoulder that should be holding the shoulder backwards in a balanced pattern. Those of you who have rounded shoulders, you can tell, just look in the mirror. And if you see your shoulder kind of bunched up right near the middle of the shoulder area, and that's not normal. It should lay flat. It's because your chest is down, your shoulders are forward, and it's usually because one, bad posture leading to muscle weakness, or muscle weakness leading to bad posture. And you have to rule those out. You could have, that slap tear, right? Yeah, well, that slap tear is just that you've screwed up the attachment, the tendon attachment, and the cartilage and so forth, and that's a whole different story. Ask your doctor sometime, what really is a slap tear, if that's what they tell you it had. I'll be really surprised if they get it right. You could have acromioclavicular pain. If you put your hand on top of the shoulder, it's the, where the two bones, your shoulder blade and your clavicle come together. It's the only thing that holds that thing together is a hard tendinous piece of material. I tore mine up on the left side many, many years ago, probably now 46 years ago, 45 years ago, on a motorcycle. We won't go into that story. It was very embarrassing, but I popped it up. I was in practice, I think my second year, and it wasn't good. I promised my wife I wouldn't ride motorcycles anymore, and see what happened. What happens when you break your promises? But anyway, that's a whole different story. It could be heart pain. If you get a pain kind of into the shoulder and then going down the biceps, and that's what I'm going to talk about a little bit when we go into the live stream. Pay attention to that with me today. And so you have a tendon that can get wrapped up. You have muscles that can be misfiring. You have the nerves from your neck that could be just hot on fire going through. If you have shoulder and lateral pain down to the side of your thorax, there's a nerve called the long thoracic nerve that could be pinched, that'd be causing that issue. So, when you ask the question, doc says, well, you got a slap tear in your shoulder. Well, a slap tear is damage to the upper portion of the cartilaginous ring that is part of the shoulder joint. And it's usually because of repetitive types of problems, like overhead shots with a tennis racket, or doing things you shouldn't be doing without posterior balance. Most of these things come because there's not enough, if you will, integrity in the joint itself, the small muscles, the pectoralis minor muscle, the pectoralis clavicle muscle, the subclavius muscle. These are stabilizers for the many part. There's a coracobrachialis muscle. Many of these things are not exercised properly, and they go down the tubes because then we do things that we think we can do and we get hurt. You can have a rotator cuff tear. So, well, your rotator is torn. Okay, which one? There are 4 of them. Which one is causing the problem? Your primary one is a muscle is called the supra-upper spinatus muscle, and it's got to be tested at multiple levels to see if that's it, and see if it's only showing a problem because it's overworked or it's because there's something else that's weakening it. So when you have that irritation, could it be a tear? Possibly. Do you need surgery? Not necessarily. There's a lot of things that you could do. I've spent years fixing professional athletes, the NFL, the NBA, women's professional basketball, and they're all using those upper muscles, obviously, to play their sport. What happens if you have a fracture? Well, I'd have no use of my arm. Not necessarily. You could have a little break in the bone and you could have a fracture. And 75% of these fractures affect people over the age of 60. Why? It's because your bone density has gone down the tubes, my friends, because your vitamin D level is low, or you're taking things that take calcium out of the bone, and now you get a little crack, and it could simply be that. How do you fix that? Well, you got to fix what's there, but you also have to make sure that the integrity of the bone is doing what it's supposed to be doing, meaning putting calcium back in, getting rid of the old dead bone, getting tensile strength in there. But most of you are losing. Oh my God, I'm losing my calcium. So you go to the doc and they give you these bisphosphonates to keep the calcium in the bone. And so what you have to understand about those, if you're taking any of these medications, is that the greatest amount of fractures happen horizontally. They do not happen vertically. And the bone density increases in a vertical dimension. And yes, it strengthens the bone in an upward position, but it's more susceptible to fracture across its horizontal line. So, and then there's some of them that actually will cause you to lose your calcium in your jaws and so forth, and it's an ugly situation. You can have frozen shoulder. Probably about 5-6% of the population will suffer from a frozen shoulder. And the guys that do that are, besides trauma, are people in the age of 40 to 70. And it usually happens in the non-dominant hand because you're not using it. And you got to find out what it is. And you go to the physician, it's called adhesive capsulitis. Adhesive, what does that mean? Adhesive means, something that's going to hold something together, right? The capsule is that little slap area, cartilage in there, and it's irritated. No, you have to look at the muscles that are not working. You can go physical therapy all day long. I mean, we use acupuncture, we use low energy light laser, we use pulsar frequencies, and we get these things turned around because I got to get these athletes back on the field. But you have to identify the muscles that cause the problem. If you don't know the muscle patterns that are inhibited, not working, you can't fix these things. A tendinitis problem, if you move the muscle, it hurts. If I move the muscle, it doesn't hurt. A bursitis is if I move it and you move it and it still hurts, it's a bursitis.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Natural Solutions for Shoulder Pain on Wednesday, March 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.